We're here today to talk about how the coronavirus is affecting the healthcare in two different African nations. We have Peter Hagono from Kenya and Katwesige Wycliff in Uganda. My first question is, what are the biggest problems the health system in your country has experienced due to the coronavirus?
Yeah, thank you very much, Matthew. The main issue that the main problem that our country is facing, especially the health system, is the rapid spread of the pandemic, the rapid spread of the disease. Actually, when I can clarify on this, uh, the first case was reported on the 20th of March, and today is 29th of March. Uganda has already recorded the 30th case. uh, this is a very rapid spread. Actually, if it continues at this rate, within 1 year or 3 months, it will be a catastrophe for the country. So that's one of the main challenges that the system is facing. The second challenge is the infrastructure development for the country. The health system infrastructure is very poor. In that the health system is actually sick itself. There is no proper equipment uh, to manage such kind of cases. Such cases like coronavirus requires a system where we have proper emergency care units which can manage these cases, isolation departments which are not well situated in every part of the country. So when we have coronavirus, the health system is overwhelmed in terms of having emergency care facilities to manage the cases. Although now we are currently managing because the country was aware of the spread of coronavirus before, and it set up some of the emergency centers in Entebbe and Mulago, the national referral hospitals. But when it comes to upcountry, where the country has decentralized its healthcare facilities, if we have coronavirus in a district far away from the center, we are likely to have a lot of challenges in managing coronavirus, especially the poor emergency care units facilities. Secondly, Uganda is grossly health system is grossly understaffed. The personnel is limited personnel. There have been migration of workers outside the country, specialized skilled workers out of the country. So those who remain in the country are also overwhelmed already. So coronavirus will only aggravate the overwhelmed health workers who are very limited in these facilities. So one of the challenges we are facing now is limited health care workers. The other challenge we're having is a landlocked country, people who move in regularly from across borders, from Democratic Republic of Congo, from South Sudan, from Burundi, from Rwanda, from Tanzania, Kenya. As we talk by now, we have East African community where we have visa-free movements. So the country is actually connected with the neighboring countries which have been having coronavirus. So after the Minister of Health announced the
Sorry, I was wondering if I could just interrupt you for a second. Am I to understand that there's still traveling going across the border at Uganda?
yeah, Uganda borders with Kenya, Rwanda, is Congo.
Uh, sorry, thank you for sorry. I didn't mean to interrupt you. I'm just surprised to find out that there's still open travel between the countries.
Yes, so people are still moving from in and out of Uganda, and though the president passed the directive to close off these borders, but still pockets of people moving across borders to look for means of livelihood still exist. So in this case, it is a challenge that we can have cases coming into remote areas where testing services are not available, where the reporting system is very poor, and that will pose a big challenge, and we can have cases coming out from these neighboring places which are very far away from the center where we can detect them. The other challenge is the political will to support this. At first, the country was aware that we have coronavirus, and there was the Minister of Health had advised closure of airspace, closure of borders, but still the country continued to make the flights continue to operate throughout the country until we had cases coming from Dubai, Middle East. The first case actually came from outside. Initially, Uganda had no case of coronavirus. Many Ugandans are working in the Middle East. So the first case was detected from a Ugandan who traveled from Middle East. So we had the case coming into Uganda. So as of now, the president has gone ahead to close the flights, which is a very good sign, which we appreciate from the political side. And that one gives us some breathing space, that this airspace is closed. The borders, he has also dispersed security on the border posts such that we don't have these porous borders bringing in people from the neighboring countries. This is a very positive sign, but it has been a major challenge in the past few days that would have spiked the number of cases of coronavirus high. The other challenge we are facing now as a country is reporting and communication, especially from communities away from the central. Uganda is a decentralized state whereby health services are provided in districts. So in case there is an outbreak, in such case, in lower districts, it will be very difficult to report unless we have systems being put in place. The other challenge is training. Of course, people needed training about coronavirus, how they can handle, how they can manage the case. People have limited knowledge on coronavirus. Even the health workers have little knowledge. We have had cases whereby health workers run away from the patients, which is not very good. So at first, before coronavirus had arrived in Uganda, there was need to train, but all comes around the budgeting for the health sector, which is very low. They cannot support training. We cannot support training everybody. So we actually have to rely on social media, internet communications, and so on. So the health workers can only rely on internet media, social media from central to get knowledge about corona. The challenge is equipping the health workers who are going to manage the coronavirus itself. At this time, we needed to have protective gears in health at the hospital, having equipment put in place in case a hospital gets a coronavirus case, how they can protect themselves. But if they are not protected, one case of coronavirus can result into death of many health workers as well. So those are the key challenges I can briefly highlight for the moment.
And Peter, what about in Kenya?
We had the first case of coronavirus on the 13th of this month. This was a lady who had traveled from the US through London into Nairobi. Unfortunately, it was not discovered that she had the virus in the first place. And so she had a lot of time. She traveled all the way to Western Kenya. She met so many people and came back to Nairobi. So the social contacts he had are very many. And as I speak now, the government is searching for them so that they can be put into isolation in hospital and be treated. Right now we have 42 cases of COVID-19 in Kenya. We lost one of them yesterday. This is a man who had traveled all the way from South Africa through Swaziland into Nairobi. The challenge we have now is that we don't have a proper healthcare system. We don't have enough hospitals, enough healthcare workers. We don't have enough drugs. This will be a very big challenge for us because the way we see the rate of infection is increasing by the day. From case 1 to case 42 today, it is a very big challenge for us. Again, most of the Kenyan workers are self-employed. Some are employed by companies. A few are employed by the government. These people who are self-employed live below $1 in a day, which is a challenge. Now we have a curfew in Kenya. The curfew begins from 5 a.m. to 7 p.m. We are told to stay at home, and most of these people live in slums where there's no sanitation, no proper toilets, no water. It's a very big challenge for us. Children have been sent from schools back home just to let them stay at home and not get the virus. It's a big challenge for us.
And Wycliff, you sort of answered my second question as well, so I won't ask you to repeat yourself. But with Peter, what are your thoughts on the consequences for the public health of your country?
Yes, the consequences now that we have are many. Because as I said before, most of these workers are either self-employed or work in companies run by businessmen. Some of them have lost jobs already. I see a situation whereby people will go hungry because there's no food, there's no money. As the rate increases by the day, I'm just wondering, just in case we get many people infected with the coronavirus, how will they be treated? If we don't have enough drugs in hospitals, we don't have enough doctors. The government should do enough to tackle this problem. They should deploy so many health workers. They should inject enough money into the system to help people. There was supposed to be mass testing in towns and in the villages, which was to begin today. So we are looking forward to the mass testing so that those who are found to be having the virus should be taken in isolation and be treated. The government should take care of those people who do not have enough food and water. They should look into those people who do not have enough toilets and those people who walk around in towns and everywhere, they spit everywhere, which is a big problem. I'm looking forward that the government will do something about this, or else it will be a very big problem. It will be a mess and disastrous. Thank you so much. They should look into.
Great. Thank you so much to both of you for answering my questions. I hope you both stay safe and take care during these difficult times.